Hey Care Partners, Teresa Youngstrom coming to you today from home. It's the end of March and 2020, and as most of you know, we are quarantined at home, so I didn't want to stop sending information out. So today we'll just do this from my living room, and that may or may not be Christmas decorations still on my mantle, so a little grace there, but guess what? None of us have it all figured out, right? But what's important today as Teresa Youngstrom, I am a dementia specialist. And so right now with the quarantine, there's a lot of wheels falling off with our loved ones who don't understand what all's going on. So I want to have a teachable moment with you today and go through a scenario and maybe give you some tips along the way. So a woman called from a nursing home and she was very frustrated, right? Because nobody comes to visit anymore and nobody brings her supplies. Let's stop right there. So is that statement true? Well, I can tell you the statement's not true because there are people that visit her and there are people that take supplies. We are limited right now, but there are actually people going to her window to visit, which is kind of fun. An idea for you if your person is on ground level. But so I know right away that's not true. So would it be wise to go ahead and correct her from the get-go and set her straight? Okay, everybody say no. Bad idea. Bad idea. If they have memory failure, if they have dementia, your logic isn't going to register with them. Guess what? They could care less about our logic. Sorry about that for those of us that like to be right. Is it time to fix her? No. Okay, so what we need to do is figure out how to come alongside. You know, you've heard me talk about how we just need to accept and agree. And those are that's good advice. Today, we want to take it a step further. Today, I want you to be able to acknowledge where they are. That's a little bit further. That means that when they call very irate, we can't say, yeah, because they're not going to listen to us, right? We aren't connecting. It's about relationship. And so if you're upset, I need to be upset with the situation. Wow, can you believe that's happening? Or maybe it's like, wow, that's amazing. I had no idea. But you meet them emotionally at the level where they are. And then worry about talking them off the ledge. Okay? So meet them where they are. Wow, I can't believe that's happening. You know what? That is frustrating. And she might say, yeah. But at least you're getting on the same page. Now let's work on redirecting her, right? And so what I need to do is accept and agree and be part of a solution for her, not part of the problem. I don't want to go into a dissertation about coronavirus and why it's contagious and why that's just not where I think you should go. I want to love her along into a place and gently take her with as few amount of words as possible, right? Lead her down a path of redirection to a happier place and engaging maybe in something else that'll take her brain to work on something else. So maybe I suggest we make a list of what she really needs, because in her mind that looks like I'm going to help and be part of the solution, right? If your person isn't there, maybe we need to just redirect to a happy place and talk about something that you know is positive in her small room there. So maybe you talk about what movie she's watching right now, or maybe what birds are on the bird feeder currently. Something like that to redirect her to a happy place. Another good place to go is if they do have a photo album that's special. Remind them of that great picture of the two of you in that photo album that you love to look at. And you know what? That photo album might be right over on your bedside table. And maybe see if you can direct her to something more positive. So we're going to acknowledge their pain, where they are. Listen, it's brain failure. If they're coming at you with a high level of frustration, chances are there's something stimulating that. She might be bored. She might have a fear going on, anxiety. There might be something painful going on. So try and be a good assessor of what's going on. We're going to acknowledge the pain and then see what we can do to come alongside. Will this work every time? No. All right, so we got to keep trying. But if we find something that works, let's use it again, okay? That's how we can learn. Now, will it always work? We find this great answer that works and we lead them back to a happy place. Will it work every time? No. Remember, this brain disease is chronic and debilitating, right? We haven't figured out how to stop it yet. So as soon as we figure out what works right here, in time they will go to a different place. But it also means their ability to communicate with us goes to a different place. So what I'd like you to learn to do is let's love them to the best of our ability where they are in their disease, right? Because it's going to change, and then there'll be less communication as time goes on. All right, part of the solution, not part of the problem. All right, and when all else fails, remember that you can say you're sorry and try and use that to diffuse anger. All right, so those are thoughts for today. I hope it helps. My name's Teresa Youngstrom. Be sure and visit our website, teresayoungstrom.com, and let's look for more videos coming out from a better approach to memory care. Thanks, you guys. Stay strong.